Yes.
Right. Thank you. I'll now move on to the apologies and roll call of attendees. And we have apologies this afternoon from Councillor Lachlan Bruce, and he has nominated a substitute, Councillor Jeremy Findlay, and also apologies from Elizabeth Gordon. Are there any other apologies that I'm not aware of? No, that's great. I'll now go through the roll call. So if you could just confirm when you hear your name, please. Shameen Akhtar.
Present.
Lynn Jardine.
Present.
Jeremy Findlay.
Present.
Carol McFarlane.
Present.
Andrew Cogan.
Present.
Fiona Ireland. Is Fiona not here? Okay. Peter Murray.
Present. I've got an out of office response from Fiona for an email I sent to her out until the 8th of November.
All right, okay, thank you. Maureen Allen. Maureen? She was here. Are you here,
sorry.
Maureen? Yep, thank
She's
you.
here.
David Aston.
David's had trouble getting in, so I know he's emailed the admin team in the partnership, Fiona, to try and there's something with the
Okay.
link. So he is trying to be here.
Okay, thank you. David Binney. Lindsay Byrne. Philip Conaglan.
Present.
Thank you. John Hardman.
Present.
Okay. David Hood.
Present.
David King.
Present.
Claire MacDonald.
Present.
Claire McIntosh. Marilyn McNeil.
Present.
Thomas Miller.
Present.
And Fiona Wilson.
Present.
Thank you. Can I ask if any members have any declarations of interest to make? Councillor Akhtar.
Fiona, just on the declaration of interest, on paper 8, there is reference made to Care and Repair East Lothian. I am on the advisory board for Care and Repair East Lothian. Whilst we're not making any decisions on Care and Repair East Lothian themselves, I just wanted to note that for the minute that I'm on the advisory board for them.
Thank you. That's us ready to start the business then, Chair.
Thank you. Move on to agenda item number 1, which is a minute of the East Lothian Integration Joint Board meeting from the 21st of September 2023. Okay, be happy to agree the minutes. Okay, thank you. I see a nod of heads there. Thank you. Move on to agenda item 2, which is matters arising from the minutes of the meeting on the 21st of September. Do we have any matters rising on page 1? Page 2? Page 3? Page 4? Page 5? Page 6? Page 7? Page 8? Or page 9? We don't have any matters arising. Thank you. Move on to agenda item 3, which is the Chair's report. Since the last meeting, there's been quite a few things that have happened. There was a meeting of chairs and vice chairs of integration joint boards with Scottish Government with Caroline Lamb and Angie Wood, and the purpose of that was to look at a number of areas. One was around data and one was around winter planning, so that gave us an opportunity to ask us when the winter plan would be made available, and if within the winter plan there would be additional resources available for us when it came through. So you will have seen just a couple of days ago up to 12 million has been allocated to expand hospital at home, to enable people to be treated at home rather than be in the hospital setting. At this moment in time, we're not aware of what that means for us. And once we have more clarity, we'll be able to share that. There was also quite a lot of information around data sharing, a data dashboard having been produced, which looked at 14 different measures for each integration joint board that would be made available, that you could see at a glance of a lot of information that we already have all located in one place would be made available, and people could use that. Integration joint boards could use that, and it maybe looked a bit like what the National Care Service might look like, what the level of information provided to the National Care Service, having an oversight of all the integration joint boards and the information and their performances was shared with us. And I know, Peter, you were there at the meeting as well. I don't know if you want to say any more around the data sharing.
The only additional bit to me that may be just helpful for people to be aware of is that this information, or something very like it, had been previously shared with chief officers, but my understanding is that the chairs and vice chairs are now going to get access to this data, and it's going to be used predominantly for a comparative assessment of where we are in relation to other areas, so we can use that both from an interrogation of our own performance and as we compare and contrast with others.
Yeah, thank you. Yeah, just one thing I was quite conscious of, that when we are interrogating and looking at the data, that sometimes we're comparing apples and pears, and we make sure that we're aware of the context of some of the background of the data that's been shared. Some of the other things that have been happening, I've had the opportunity to visit Trinent Day Centre and Roots and Fruits, the local community-based project in Elphinstone, and it gave me a good oversight of a lot of the early intervention prevention work that's happening locally to support people. There've been a number of events around East Lothian and the local housing strategy, and there was one at the Fraser Centre this week, and there'll be another one the last one will be in North Berwick on the 2nd of November. And on the local housing strategy, there was a really strong emphasis on health and social care and the ageing population, enabling people to answer questions around the type of housing, etc. So I know that's something we've talked quite a lot about as an ageing population, the needs of that ageing population and ensuring there's appropriate housing. So I thought that they did quite a comprehensive overview of the issues that would affect health and social care and an ageing population, and enabling people to go along and give their input to that. We also had a development session earlier this week on the ageing population, so thank you to all the IJB members and staff that came along. We had a really positive session going through all the main areas that I know the team are going out and about and talking to area partnerships and health and wellbeing groups and community councils. I know I've seen Fiona at Gifford Community Council and Laura and Jane Ogden-Smith at Pencaitland Community Council last night, and I think that's been a really valuable exercise for members of community councils and communities to hear about the work that's been carried on and get their feedback, but also it's a really good way to know what's happening locally, and I think it gave local communities the opportunity to talk about the work they're doing locally to support older people in the prevention agenda. The other thing I wanted to mention was that we will see there's been the really early stages of the local development plan that have been starting the ball rolling on that one. So I think it's really important, the briefing that I attended, the focus of infrastructure, and that's infrastructure in its widest context, and infrastructure around health and wellbeing and pharmacies and medical practices while those houses are being built is a really important aspect of moving forward in the new local development plan. Two other areas where I know it affects older people is around the food bank extraordinary meeting took place, and it gave us a good oversight of the huge work that's going on to support people during the cost of living crisis and ensuring that they're supporting their health and wellbeing. And I attended the bus forum because I know that's quite an important area for health and social care around the connectivity of getting around East Lothian and having that public transport to be able to access those local services. Okay, I don't know if anybody has any questions or if there's anything else you want to add, Peter.
No, nothing from me, Sinead, thank you.
Okay, but more than happy to to meet anybody to go through any of the areas that I've mentioned, but just making sure that the issues that their strategic directions and what our priorities are being highlighted at those meetings. Okay, move on to agenda item number 4, which is our financial update. And I'd like to welcome David King, who's the acting finance officer for us. So I will let you present the paper, David.
Thank you very much, Chair. I couldn't resist the temptation to look at the very first meeting of this IJB on the 1st of June 2015, and both the Chair and I were there. Actually, interestingly enough, Thomas and Maureen were also nominated for their roles, but I'm not entirely sure if they were there or not. Now, the interesting thing for me, as everybody here knows, I've kind of been in and out and back in again, is that we had set up this new body, the Strategic Planning Board, whose product was a strategic plan. And we were going to deliver it through directions and all that kind of new process, which we'll be talking about later in the agenda. And it's really, I'm really very pleased to be able to come back and see how things are going. It's from my point of view, it's very kind of you guys to have me back and allow me another bite at this particular cherry. Anyway, come on to the paper very quickly. It's a brief paper. I think there are 4 points in this paper. The first thing is to update the September paper where we talked about the 22-23 financial position. Now, in the September paper, we had the Q1 review. We've now got the month 5 information available to us. Excuse me. And as you can see, the position has improved slightly. That said, the position is still not at all good, and we're extremely anxious about it. Now, if you look at the integration scheme, what it says about recovery plans in year is that the partners will go away and develop recovery plans and report them back to the IJB. Now, the partners have been developing recovery plans. Month 6 information is now available, though it hasn't been published by the partners yet. And again, the position is improving. So I'm working very closely with the partners who've been tremendously supportive, and we'll work through this process. And I hope by the time we get to December, we'll be able to strike some kind of position on what 22-23 looks like. The second point then is the financial planning process itself, so 24-25 and beyond. Now, I know that Claire put a paper to this board on December 22 and sort of had a 5-year financial plan, and these numbers were pretty horrific. You guys will remember that. I think I quoted it in our paper here. The position hasn't improved from where we're sitting. There's a lot more pressures in the system. I've sort of sketched out the ones that sort of come screaming off the page, if you like, in the paper. Our partners are also working on their 5-year financial plans, and again, they're feeding the information back to us, and that we're involved in that whole dialogue. And I like to think that we'd be able to have revised the financial plan in December, but it's going to mean that there will be a whole series of very, very challenging decisions that require to be made. Even if we manage to maintain the baselines, and I know there's been discussions around that in the last couple of years, it still means, you know, you don't have to be able to do all the arithmetic to see that there will be financial gaps. And I think everybody in this room, this virtual room, knows what kind of challenge that actually means. 2.3 then, sorry, the third point is an update on the annual accounts. I think I said in the paper that we'd try and bring them back to the IJB in November. That's not going to be possible. The proposal at the moment is to bring them for approval to the IJB's audit committee in December. Now, clearly the blame for these annual accounts being so late, and this is a no blame system, lies entirely with the external auditors who've been extremely open about the whole thing. They started the process late, they had resource issues. East Lothian's accounts haven't been signed off either. So, you know, the IJB is just sort of going along and getting these things sorted and finished. And the last point then is about looking at the general reserve. Now, the IJB made a commitment to contribute towards the costs of moving from the analogue to digital alarm system. And we earmarked about £740,000 for that. Now, that money should now come out of the general reserve and go into an earmarked reserve. Now, that's just a technical issue, and I require the IJB's permission to move money out of its general reserve. But at the same time, you can see the impact of the arithmetic means that the IJB's general reserve is now sitting at around 2%, which is the IJB's own reserve position. So it's to ask the IJB's permission for that. So, Chair, do you want me to take questions, or how would you like to proceed?
Thank you. And can I ask if anybody has any questions?
Mr. Aston. Hi, it's Rob Kerr from the partnership here. I believe you have.
And Peter?
Yeah, David, you may not be able to answer this question, but it's just a general point on the 4th item you covered. Do you know how the digital analog to digital is being funded across other partnership areas?
And no, I don't actually, to be honest with you, Peter, having come back into the position. What I will do, however, because I think it's an extremely significant issue, is I'm going to go back round there's a National Chief Finance Officers Network for all the IJBs and just ask the question. So I think it'd be very interesting to know that and have some kind of indication of what other partners are doing.
Okay, thank you, David. Fiona?
Yeah, I know we've asked this question, I think it's from SPG, but David Clare's already asked the CFOs and there is no funding. But one of the actions for me, but Leslie does have documentation was to follow up with the digital office. And I think, and I'm looking because I think Leslie is here, yes. You have had documentation back and it was a no funding, was that right, Leslie?
It was from a David Brown from the Scottish Government. We went to him to ask about funding and we were told there would be no funding. A letter from David Brown.
We can share that with you. And I guess the question, David, is have the other IJBs done something different would be a question, but we have heard there's no funding.
Yeah, no, sorry. I've heard there's no funding as well. I apologise. I was answering a slightly different question. What I was thinking in terms of what are the other IJBs doing? Are they funding it? Are the local councils funding it? That was the question that was in my head, Peter. Sorry, that was the one I was going to chase after.
Okay. Does that answer your question, Peter?
Yes, in part it does, but I suppose the basis of my question was more about when the decision was made to go from analog to digital, what was the dialogue that took place between, I'm going to assume, COSLA and Scottish Government about how it was going to be funded? That's the basis of my question. And if there was something out there that said it was going to be funded, I would just be curious as to why we've got to where we've now got to, which is that we're funded, as an example, through reserves and not looking at some central pot that we could tap into.
Okay, thank you. I think that was brought up at the student planning group as well, wasn't it? I think it might have been yourself to say, look, let's get back to the kind of policy from day one, the policy intent of it. So we're really clear for ourselves as well. And thank you for writing, for approaching, I think it was the digital office. I think we'd asked for them to be approached, especially knowing what our demographics look like for that information. So thank you for doing that, Leslie. Andrew and then Lynn.
Yeah, hi, thanks, Shamin. David, I'm sure you said then it will be December time before we'd be in a final position to have an accurate year-end projection. The challenge with that, and this is looking at Fiona particularly, is if that is a significantly adverse position, that leaves a quarter of the year to put in place any further mitigation. And I just think we should acknowledge that as a significant risk if there is any significant challenges coming from that year-end projection. And it's just to look to Fiona, is there capacity within the teams to put in a relatively short-term contingency with only a quarter of the year to go?
So we are working on this already. So we have got recovery plans in place. We've got workshops set up. So we do have that. I think part of the challenge has been and resulted in a positive is around some of the projections, and that's why we've got this improving position. So the really good work that we've done with our council colleagues has helped that, and that again is improving month 6. So we've got the recovery, but it's balancing it, right, Andrew, around that recovery and the actions we're taking just now versus actually what is actually correct and realistic and not just projected. Would that be right, David King? So I'm conscious very a lot of Davids just around the approach we're taking.
Yeah, I mean, you're absolutely right, and you're right as well, Andrew. I mean, the issue is that we don't control the levers. You know, we're a strategic planning board. The partners control the lever, and I know that's a strange remark because Fiona also has a very, very significant management role, both in the health service and obviously in social care. Now, the integration scheme simply says, I'm sorry to quote it, that, you know, the partners will come back with the recovery plans. Now, they're doing that. As Fiona said, they're doing that. They're working really hard on that whole process, and I've got every confidence in them. what the IJB, and you're right, Andrew, even now, what could the IJB do to issue an instruction to the partners to recover that position when the partners themselves are still developing the final position? You know, between the Q1 and month 5, it's dropped. As I say, the early indications from month 6 is it's dropped. There's terrible forecasting issues with the GP prescribing budget. The information for the GP prescribing budget is, you know, several months. I think we've got 1 or 2 months in the current financial year. So I'm just sort of picking at the wee bits and pieces. So I absolutely accept what you're trying to say, and that's the challenge with all these financial management in year things. But I think that the partners are working very hard on this, and I've got a lot of confidence in them. And I think we can come back at December and take a realistic view. And yeah, we'll see what it looks like then. I'm sorry, I know I'm not helping. I think that's where we're going.
The reason for highlighting that is that that's an in-year challenge, but when you look at the projections for year 2, 3, 4 of the forthcoming years, those mitigations that we'll need to take both as a board and as the partners of the board will become increasingly challenged. I think it's just important to again recognise some of those challenges.
Yeah, no, I absolutely agree, and I was trying to say that probably not terribly well. But certainly, you know, the important thing about looking at the current year is say, what does this tell us about the future years? And you're making a really, really strong point that. And I know that people have started that planning process already. I mean, that planning process has been going on for quite a long time, which is why that paper went to the IJB way back in December. So there's a lot of further work to be done in that, and we'll bring that back to the IJB as it goes along.
Thank you.
Did that answer your questions, Andrew?
It did, yes, thank you.
That's great, thank you. Fiona, did you want to come in on this point?
Yeah, and just, I suppose, just reflecting on the last year, to Andrew's point, I guess the other point, David King, is just around there's processes in our partners, so the pay award being handed over will be another consequence that we at this stage can't influence, and it has to go through the proper process through the council in this case. So that's the stuff is a risk that we can't control, although we are hearing the right noises. It's only fair it goes through the right process, and a decision is made in that way before we know. So you're absolutely right to raise it. There's stuff that we can control and there's stuff that we can't, and we saw that last year, and we have to still mitigate against that as well, Andrew, of the stuff that could blindside isn't the right word, but the stuff that you think you might get but might not.
Okay, and Lynn?
Yeah, just on a couple of points. First of all, back to Peter's inquiry around the analog to digital, just to say, as far as my understanding as a housing professional is, a lot of housing providers who deliver similar systems have had this built into their own financial planning for a number of years. So that leads me to believe there has not and has never been a central pot of funding for this kind of work. On the financial situation, I think officers need to be commended for the really positive work that has been done over the last short while to reduce the predicted overspend as much as it has been. But I wondered if there's something that we can learn from that in terms of what's been the driving force in pushing that forward, and can we take that impetus to as a core development element of any future projects to make sure that we've got that rigor around finance, monitoring spend, etc. as well there.
I mean, yes, is the answer to your question. We do this in a kind of strange way. We do this every year. We start off the year being overspent and then break even at the end. And we need to get out of that because it wastes far too much time around this table discussing things where we should be considering worrying about what happens in 4.5 and 5.6 rather than sitting anguishing over what happens between now and the 31st of March. So I absolutely agree with you, Lynn, and we'll try and work that into our planning and monitoring processes a wee bit better.
Okay, is that okay, Lynn? Fiona, did you want to come in on this point?
Yeah, I was just going to come in as well. Absolutely fair point, Lynn, and I suppose just how we're working through our partnership financial overview. So forecasting, how we're working together has I think improved significantly. That helps that process and the relationships there. So it's a really kind of agile meeting around recovery plans, correct forecasting, where before it was a little bit off. And remember, we've got Gareth, I have to get the right name, Laura, I think Davis, in supporting us. I'll have it wrong, but we've also put in additionality around that kind of monitoring processing as well, that helps the position. If that gives you kind of any operational assurance as well, that supports that kind of strategic direction.
That's great, Fiona, thanks.
Okay, thank you. And Peter?
The two quick things, Siobhan, thank you for that again. Thanks to Lynn for that comment about the housing, and that may well prove to be the case, but I think it's just worthy of asking it, just to make sure. And whilst I 100% agree with Lynn in terms of the financial management point, and I think it's something we should be assured of and seek assurance of, we should also, I think, understand from Fiona's perspective and her team, what's the impact on outcomes for a change in the budget. Because it's all very well to say that we should be sharper and our pencils should be very sharp with regard to financial management, which I 100% agree with. But we should also know the consequences of budgetary changes if they are outcomes that change as a consequence of a change in the budget and the management of this difficult position David's been describing.
Okay, does anybody want to come in on that point?
Well, I was just going to agree with Peter. I think there's actually a section, even in the reports themselves, gosh, there used to be is there integrated impact assessment. Now, you know, when we come and look at all the actions we're going to have to take in order to bring ourselves back into financial balance, then that's going to be very, very challenging to write. Exactly what Peter said. So if you don't have this resource to do these things, what impact does that have on the people whom we've been tasked to provide health and social care to, or plans for health and social care? But you know how the strategy works.
Okay, thank you. Do we have any other questions? David, I've got one around, it might be too early to be able to say what the implications for us will be for the winter planning and what we might see coming through the system for us in East Lothian.
I haven't seen anything yet, Chair, I'm sorry. Nothing, but as I say, the partners, I mean, well, NHS Lothian, I know well, have been extraordinarily good in passing information on, so the minute it turns up, we'll bring it back here.
And Fiona?
So I'm tag teaming David. Yeah, I've raised just the same knowledge that you have, Chair, around the hospital home. I've raised that just with my unscheduled care hat on, just to know when we might hear about that coming through. And we have put together winter plans, just a kind of level of assurance giving ourselves within East around delivery of services. But there's not huge amounts, as had been in the past, of funding coming in to do that kind of 3 to 4 month period. And it seems to be targeted at the preventing or taking away from hospital beds, which is good. That's what we want to do, but not huge amounts of resource attached to that. So we'll just keep you informed. But I have already flagged just to see how we get that information quickly.
Okay, thank you. Do we have any other questions at all? No, I just want to thank David and all the finance team for the presentation of the paper and all the work going on. So you can see in sections 3.2 that there is an improving trend, but I know it's a difficult and challenging time. And I know that in the risk register that is quite high up there as read and with both partners, but also I think we're taking every opportunity possible just to highlight the good work the East Lothian IJB and the Health and Social Care Partnership are carrying out and the positive outcomes that we're delivering on, and the importance of being able to have that level of resource to keep sustaining our levels of delayed discharge, but also all the other preventative work that follows to support individuals across East Lothian, taking every opportunity to do that at COSLA and IJB and Vice Chairs meetings and any other external meetings on behalf of East Lothian. So and we'll get more information around if there is other resources funding coming through the system at the next financial report. So thank you for that. So this paper 4 requires a roll call, so I'll pass that on to Fiona Curry.
Thank you, Chair. The recommendations are set out in section 2 of the report. I'll come to each member individually. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agreed.
Councillor Jardine.
Agreed.
Councillor McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you. That's the recommendations agreed unanimously, Chair.
Okay, thank you. Move on to agenda item number 5, which is the East Lothian Dementia Strategy 23-28, and that'll be presented by Ashley Hardy.
Thank you. Hello, there's a lot of people on the screen that I probably haven't met before. So my name is Ashley Hardy. I'm a Strategic Planning and Commissioning Officer in the Planning and Performance team. Just here today to present the work that we've been doing on the East Lothian Dementia Strategy over the last year. This has obviously been done in partnership with my manager, Christine Johnson, who's also on the call. So we do now have a final draft in place, and that has been sent in for submission today. Just to say, it is the first time that East Lothian has had a separate dementia strategy and planning for this service user group. Actually has previously come under the remit of older people's planning. But I think just with recognition, there's been increasing focus nationally on dementia, and also with the expectation that we're going to see quite a significant increase in numbers of people being diagnosed with dementia, that it was felt that a separate strategy was needed. The government has actually just published their 4th National Dementia Strategy that came out this year. It is a 10-year strategy, so a much longer term vision for dementia services in Scotland. I would say that the strategy that we have developed locally is very much in line with the themes in the government strategy, but I would say it also very much matches the feedback that we received during our engagement. We've tried to embed a human rights approach within the strategy using the Charter of Rights for people with dementia, and the outcomes that we've taken have actually come from the work done by the Life Changes Trust. So these are outcomes that have been set by people with dementia and their carers, and not by the partnership. So I think that's quite an important distinction to make. Alongside our strategy, we actually have quite a detailed technical report. I apologise in advance for the length of that. But it contains all the data that we have gathered, some of which, for the first time, and also looking at the summary of all the engagement that we have done as well. Just a couple of key points of the data. It does show that by 2040, we're expecting an increase of around 68% in terms of the number of people with dementia in East Lothian, so quite a significant increase. We're also going to see, very much similar to the national picture, higher prevalence among women. And what we're already finding, so with people with an existing diagnosis just now, that there's higher numbers towards the west of the county, particularly in areas of higher deprivation, with around 20% based in Musselburgh and Wallingford at the moment. So I think this data and the technical report will be very helpful, particularly the geographical data, when we're looking at developing services and considering where we need to target services. In terms of engagement, we did a lot of engagement over the past year. Including commissioning an external provider outside the box to do community engagement with people with lived experience on our behalf, and they spoke to around 117 people. They actually did that using a storytelling format, which is an easier way for people with dementia to contribute stories, and their opinions are important to them. In addition to that, my colleague Jane Ogden-Smith has been doing a whole raft of engagement as part of her work on the IJB strategic plan, as well as the planning for the ageing population consultation. And there was a lot of feedback within the work that she had already done on dementia and dementia related services. So she very helpfully pulled that out for us, and we were able to use that towards our feedback as well. I also held one-to-one sessions with a range of key health and social care partnership professionals, right from primary care trying to understand how people come into the dementia pathway and what they're presenting with and their concerns, to talking to the consultants and the CPMs at the memory clinic who actually do the diagnosis, through to our LT service who support stress and distress behaviour in care homes and AHP Smart Tech colleagues, right through to palliative care and our care home providers. We've also worked very closely with key partners such as Dementia Friendly Lothian and Alzheimer's Scotland particularly, to understand their challenges, what they were seeing on the ground, and also how they felt our service should be built in future. And also we've been in touch with UCL on a similar basis as well. With the first strategy in place, we actually tested that out directly again with people with lived experience, and we did that through the Dementia Friendly Lothian friendship groups. We also placed it on our consultation hub for 6 weeks over July and August this year, and actually got a very good response rate. We had around 82 people responding, and I think some of the feedback in there around people's priorities will be very helpful as we move forward towards the next stage, which is developing an implementation plan. In terms of what the main changes of strategy will bring about, probably the biggest one is about the recommendation of expanding our model of post-diagnostic support, looking to increase that from the current 1 year's entitlement that we've got in place using Alzheimer's Scotland to developing it to over the lifetime that people have dementia, obviously including within a care home setting. We're proposing actually using the Alzheimer's Scotland 8-pillar model to do that, which is a model that's more appropriate for as the condition advances. And within that service, what we'd also like to do is implement a single point of contact, so that that's something we heard a lot about, that people wanted to be able to pick up the phone and get help and support when they need it. And that could be anything from supporting with managing behavioural challenges to OT, social work support, or even mental health support, as well as just general advice and guidance. A further theme that we've got throughout the strategy is around improving information. And that needs to be looked at not just in terms of providing information at the point of diagnosis, but through all points of the pathway. We did initially think that it would be a good idea to develop a dementia pack to present to people at point of diagnosis that they could then take away and use as and when required, including community resources. But people were very clear at consultation that they didn't like that idea. They didn't want to be overwhelmed. They wanted it to be given on a phased approach. And they also wanted that information to come from other sources rather than just the Health and Social Care Partnership. So we need to look at how best to approach that in future. Another key area that we wanted to focus on in strategy is on training. And now we do have some training in place, but it's not used consistently. We need to look at training in terms of not just delivery for our own frontline staff, but also in terms of supporting care home providers with stress and distress training and sensitisation training, as well as availability of stress and distress training within a hospital setting. The particular plea from care home managers is that it's done in a face-to-face manner rather than online, and that sensitisation training can be particularly helpful in helping carers to understand what it's like to have dementia and what it can feel like, and can improve practice. We'd also like to recommend training for carers as well, who are quite often having to deal with quite complex behavioural challenges in the person they're caring for over a 24-hour period, often without a break. And that carer support very much echoes, again, another theme throughout the strategy, which is around supporting carers of people living with dementia. There's a lot of crossover within the East Lothian Dementia Strategy and the carer strategy, so similar themes. And I think probably no one will be surprised around that we've heard again about the challenges around respite provision. We have reiterated within the dementia strategy a commitment to look at longer term options for respite. But there are some specific areas for care support that haven't been included in the care strategy that are specific to people with dementia, and that's things like supporting carers with anticipatory grief, where people would experience loss of a loved one before they've actually passed away, or the need to do advanced care planning and end of life or awareness of end of life options, so people can have those thoughts and discussions in advance. And that is something that we could look to embed within that 8-pillar post-diagnostic support model. And finally, the last theme really is around the community focus that we've got running throughout the strategy. That again very much echoes the Scottish Government strategy, and it is the area we heard the most about in terms of our engagement, the need for community activities and community support. People were very clear that they wanted us to offer a range of community activities, but instead of setting up new ones, for us to help make existing ones accessible. They're also very keen on expanding the offer of peer support and told us just how much value they get from that, both in terms of connections with people in a similar situation, but also in terms of how they, as a source of information that they can use as well. And the final commitment really around community rather is around the rolling out of the meeting centre model to an additional 5 satellite areas, with the options of looking at either a hybrid or a pop-up model for people in rural areas. So it's not by any means all of the actions in the strategy, but just a few of the key themes. We did present this, the strategy and the technical report to the strategic planning group a couple of weeks ago, and were asked just to do a bit more work in terms of what the financial implications were in terms of strategy and what that might look like in terms of implementation. We don't currently have a separate budget for dementia, and what we do know is that spending for people with dementia crosses quite a wide range of other services, including things like primary care, pharmacy, the older people's budget, voluntary organisations, and Carers Act funding as well. What you can see in the report, I think it's on page 22 of your pack, is actually a table that we've pulled together a rough estimate of what we think we're spending in terms of external providers, so commission providers at the moment. I would say that doesn't include figures for care at home. The way that our services are purchased on Mosaic is that it all is logged under the older people's budget, so we're not unfortunately able to separate that out. It's something that we need to improve in terms of gathering data for people with dementia. But however, having said that, the highest spend that we've got is on care home placements. So I think it's something like 9.3 million in terms of people with an estimate of the proportion of people with dementia in our care homes. In terms of the biggest area of spend within our strategy and implementing the actions within that strategy, we believe that would be the expansion of the post-diagnostic support service. Lothian, who have a specialist dementia team running on that model, and they have done that since 2016, have very kindly agreed to share their costs of what that service would cost to run and to set up, and we're waiting for that to come in. But I think it's worth noting, and I've put a little link embedded in the IJB report to the Health Improvement Scotland review of the Lothian model, which does show that care coordination 8-pillar post-diagnostic support model does contribute to some significant savings in terms of resource costs to the partnership. And it's something we can maybe look at and pull out a bit further at the IJB Development Day. Another area of investment that the strategy would require is the rolling out of the meeting centre model. And we're estimating about a further £90,000 to do that. Although, from what I understand, there is an option to look at if a reduced version was needed, we could look at doing something similar to what's currently running in Fife, which is what they call a roving meeting centre, which runs from town to town on different days of the week, rather than having formal bases. So we are waiting to hear if there will be any additional funding attached to the government strategy, and as such, whether the partnerships will actually get any allocation. But I do also think there is a lot of actions within the strategy that can be implemented with little to no additional funding or using existing resources, and even just a few examples of that. Excuse me. In terms of developing or improving information, there is access to the Living Well with Dementia app, which is free for partnerships to use and adapt to their own areas. It's being currently trialled in Inverclyde. So there would be no cost to develop that other than staff resources, and we could do that in partnership with people with lived experience. We could also use or explore the use of existing adult mental health resources to look at developing mental health support for people to cope both with a diagnosis and then also with the impact of having dementia, as well as using the Carers Lothian existing counselling service to support carers, make sure it's actually supporting people with anticipatory grief. We do have existing staff resources in place, such as the LCHASE team, or even our Dementia Improvement Specialist Lead, who I know is very keen to roll out and develop training with care homes. So that is something that could be done possibly with existing staff. And in terms of developing peer support and the agenda about raising awareness of dementia-friendly communities, this is actually already within Dementia Friendly East Lothian's remit and existing grant, but I think our role as a partnership could be to support them to keep that on the agenda and raise awareness of dementia generally, to help generate interest and help roll those out. So in terms of next steps for us, as I said, we've got the IJB development session on the 16th of November, and that will be focusing on implementation of the strategy and key priorities. And we've also started to use some of the feedback from the consultation and also the Dementia Friendly East Lothian gathering to help with the data around that to develop that plan. So I think I'll stop there, and if anybody has any questions.
Thank you very much, Ashley. Peter?
It's just a comment, because I was fortunate enough to hear the presentation at the Strategic Planning Group, and as Ashley has rightly pointed out, it got a good hearing there and was well supported at that group. I'm grateful for the additional information about funding, and I suppose the thing that strikes me as just a comment is the magnitude of the percentage of people within the respective areas that will be impacted by dementia in some degree. So I think the strategy and our approach to it is very welcome, and I think it's an excellent piece of work, and thank you for all those that have contributed to it.
Thank you, Peter. Do you have any other questions or comments? Andrew?
Just to echo Peter's, it's an excellent paper. I read the technical paper as well yesterday, and as somebody relatively new, found that very, very helpful in a wider understanding of the issues around dementia. So congratulations to the team who put that together as well. That was great as a board member to really understand the issues. I like Peter, I don't underestimate the challenges that this is going to cause the board over the next 3 or 4 years. And going back, I think it was Peter's points, that the issues around how do we measure outcomes and finances, I think dementia will be one of those that we have to have a great deal of cognizance around.
Absolutely. Thank you, Andrew. And Philip?
Thanks, Chair. I'd echo Andrew's point in terms of this being a great piece of work, and the engagement that you've undertaken. And part of the work is fantastic as well. I guess just to add to the points within the technical report that talk about some of the lifestyle factors that relate to, in particular, I guess a lot of the preventable elements of dementia there, a lot of those point towards things which are closely associated with deprivation, which you do make that point within the report. So I guess it's important that some of the language within this report talks rightly about lifestyle elements, which will help, but also that we as an IJB are keeping in mind the upstream things which will be helping improve that. So those bits about placemaking, when someone was referring earlier on to the LDP and getting that right in and around the LDP and promoting physical activity, important that we carry on the work in and around poverty and so on. I know this room knows that, but I guess just to reiterate the point on the back of this great piece of work. Thanks.
Okay, thank you, Philip. Do we have any other questions or comments? Actually, just to echo the remarks made by everybody else, I was really grateful to hear some of your work at the Dementia Friendly gathering. So I just want to thank Christine Johnston and Maria Burton and yourself, Ashley, on this work. And Peter's right, it got a really good discussion and debate at the Strategic Planning Group. But one thing I wanted to ask around, people have mentioned that the level of support that will be required for people across East Lothian, as by 2040, you mentioned 68%, of how we continue building on the strong partnerships that we have with the voluntary and community sector. You've talked about Dementia Friendly East Lothian, Alzheimer's Scotland, but how we build that with other partners who are delivering public services. It might be around, for example, training or making East Lothian dementia friendly with that level of support that's required. So everybody has an onus or a part to play in supporting individuals with dementia, and how do we keep that strong connection with the current partners and create more partnerships with others across East Lothian?
I think from my point of view, Christine, please jump in, but it's kind of twofold. One is around raising awareness, which I think we've kind of put throughout the strategy as a theme. So sharing information, I think understanding what people could do to help prevent dementia as well. So I think that in itself will generate interest. But I think there is, from what I've heard, there is an appetite out there to support people with dementia. I know that even thinking about Carers East Lothian, actually most of the carers that they support are people over the age of 65, often suffering with dementia. So yeah, I do think, and certainly when we've been to the health and wellbeing groups, when we've been to involved with the area partnerships, there's a lot of interest there. I know Sharon Saunders was very keen to keep those community connections going as well. And I think hopefully we'll tease more of that out, perhaps at the implementation session as well, about how, what can we do, what can IJB members do as part of their remit as well, to kind of keep that interest going.
Yeah, no, thank you, Ashley. Christine?
Yeah, I completely agree with that, Ashley. And I think part of what we're trying to do with partners is to change the narrative, so we are focusing on supporting people to live well with dementia, and we've all got a role to play with that. And as you said, Shameen, a dementia-friendly community can be a kind of catalyst for that, and it is about how we kind of coordinate our responses across third sector and through the partnership. So I think we've got a good foundation, but there's a lot more work that we can do to deliver the objectives of the strategy.
Okay, thank you. Thanks very much. I don't see any other questions or comments, but just to commend you on the piece of work. This is really a really significant, important piece of work for us, East Lothian, and I met many people and other IJB members and staff were work with families and carers with people with dementia, and just the level of support that's required that's out there, and also the huge amount of preventative work that is currently existing, and how we support that to support those families and those carers. So you're commended for the work that you've done. So thank you very much for that. And I think it's really important that as many IJB members as possible are able to take part in the development session that you've mentioned, Ashley, on the 18th of November. And that will be a face-to-face development session at the Penny Pit in Preston Pan. So I would really encourage as many people to come along and attend and make sure that you're find ways how you can, within your own role, also not just as an IJB member, but within your own roles, to be able to support this really important piece of work. Okay, thank you very much. This now requires a roll call, so I'll pass it on to Fiona Curry.
Thank you, Chair. The recommendations are set out in 2.1 of the report. I'll come to each member individually. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agreed.
Councillor Jardine.
Agreed.
Councillor McFarlane.
Agreed.
Peter Murray.
Agreed.
Thank you. That's the recommendations agreed unanimously.
Thank you very much. Well, look forward to the development session on the 18th of November. Thank you. Move on to agenda item number 6, which is the review of the East Lothian Integration Joint Board Directions, and that's Claire Goodwin.
Okay, thanks, Chair. So this report follows on from a previous report to the SPG last session regarding a review of the directions. So it includes a number of recommendations in relation to updating the current set of IJB directions. So these recommendations include looking at the current directions and make some recommendation for changes based on discussion with change boards and or the general managers as chair of the change boards. Details of the updates are included at Appendix 1. Some of these updates are needed to reflect changing circumstances or new developments. A number of directions are also recommended for retiral, so that's either due because to them being completed or because they're no longer required. There are also recommendations for a number of directions to be retained. Some of them still need to be reviewed and need to be the subject of further discussion with change boards. As well as updates to the current directions, there's also a recommendation in relation to the introduction of 4 core directions, and these are described at paragraph 3.5. These reflect a requirement for us to have directions in place for all functions delegated to the IJB. They're included at Appendix 2 and they've been developed using the directions template. The final recommendation in the paper relates to the IJB's role in giving active consideration to the issuing of further directions as and when required throughout the year. So as outlined in paragraph 3.6, these should be in line with directions policy. There's a link to the policy in the paper as well. And they should be introduced following a report to the IJB. I've included a number of examples when directions may be required. It could be, for example, where there's a significant change to service delivery or service approach, for example, as a result of a transformation programme or provisioning programme. It may be in relation to additional funding becoming available, changes to budgets or developments regarding the use of budgets. Or third example I've included is where there's been the introduction of a new strategy or an update to existing strategy or plans. I suppose the other thing to say in relation to the paper is once we have finalised these recommendations and agreed on the directions, they'll be worked up using the directions template, which is included at Appendix 3. So that's so that they include budget information, performance measures, milestones, timescales, and oversight arrangements. Happy to take any questions.
Okay, thank you very much, Claire. Do we have any comments or questions for Claire? Peter?
I think Claire and I have had this conversation before, and I understand the logic behind core directions. I do think that in time it would be more helpful if within those areas listed within the core directions that we were able to, where possible, create a specific direction that teases out some detail associated with those core direction titles, because it's quite broad. And I'm not sure it illuminates the work that goes on and the manner in which the transformation of some of those areas is taking place or should be taking place.
Yeah, I think that's a fair comment, Peter. And in some ways, the core directions are a piece of housekeeping so that we ensure that we've got full coverage of all the delegated functions. The text of the directions, the core directions, reflect the instruction that partners deliver services in line with the strategic objectives, and there's a link to the strategic plan there. So that's kind of a high level. I suppose it's to do with direction of travel and strategic direction and strategic planning. And then, as you suggest, for more detailed stuff comes as and when we require additional directions. So I think the idea of having a core set of directions is for very much a core with additional over and above these, and for the IJB to play the active role in identifying when directions are needed.
Okay, does that help, Peter?
Yeah, it does. But I suppose what as an IJB member I'd be hoping to see in time would be the plans that we've got in the order that we think most appropriate based on the risk and the finances available to us, how we propose to implement the more detailed transformation areas of work within those broad definitions of the delegated areas we're responsible for and the associated budget that Claire and her team have pulled together to cover these 4 new ones that I understand the logic of, as said. I just think it underestimates, I think, the amount of effort that's going to be required to properly resource and tackle the responsibilities that Fiona and her team have got in order to make this a really productive arrangement.
Okay. Right, thank you, Peter. Do you want to come in any of that at all, Claire?
I think that's right. That's exactly the sort of direction we should be moving in. And I think if you look at appendix, I think it's the first appendix 1. So for some of the retained directions and also the updated directions that do that job of being more specific about areas of development. I think there's one, for example, in relation to the work of the here at home transformation work. So that would be one example of where there's more detail. And I think generally, as suggested in the report, if there are developments where it's for a transformation programme or a significant change to service delivery, that's when there would be a direction. And that would be on the back of a report to the IJB where the detail is included, and then would be worked up using the directions template. So it also includes timescales, targets, milestones, and details where the oversight of that direction would sit. So I think I suppose that the bottom line is it's under development. The core directions are there to provide that assurance at the moment, and then working on the directions in and around that, and also taking a proactive approach to issuing directions as we go along. So the IJB role members. The role of IJB members is to consider when a report comes to the IJB whether it requires a direction to be issued.
You're on mute, Chair.
So Claire, there's a clear line of sight from the core directions to then falling through right down to the appendix 3 that you've outlined, where you've got the action points, the financial implications, and the delivery plan. So that's what it sounds like. So IJB members could then clearly see that clear line of sight to be able to say, look, this is how we're delivering on that direction, or we are able to deliver on it because we have the workforce and the staff to do it, or we the resources to, or we don't, and we have to reduce that work queue. Right. Does that help to answer your question, Peter?
I could go on for some time with this, Siobhan, but I won't.
Okay.
I'll draw it to close there.
Okay, I think there'll be one of these areas that we will be coming back to, Claire, because it sounds like it's an ongoing process. This won't be the last time that we see the directions. Fiona, did you want to come in on Peter's point?
Yeah, and I did smile when he could go on, but I suppose it's reflecting on the situation and the landscape we're in just now, and particularly around things like set aside is one thing. I think, will that detail that we talk about need to come into that direction that might feel a bit broad just now, Claire, that actually we might just say, no, this is what we want to do from any perspective. I'm thinking of an example. It's not that it's worked up, but the work of InReach, or that kind of, actually we're moving it forward. And I suppose I'm just thoughtful then, does that get to Peter's point around a little bit more detail around that direction? And there'll be other examples, and I suppose it's just that thought, given the landscape we are in, the landscape our partners are in, for us to enable our kind of strategic direction, that may up around that level of detail that we want around the directions. Is that what you're thinking, Claire? Because that's what was in my head, and I think is starting to play out. And I hope that helps answer your point, Peter.
Okay, thank you.
Success.
And Lynn?
Thanks, Chair. My question is really around on Appendix 1 around the retirals. I understand the logic behind completed or superseded. There's a couple that I would just want to get a bit of clarification on. So in terms of cluster work, I wondered whether the recommendation that's in there might more accurately be reflected by it's completed, if we're saying that quality improvement activities are in place and work's ongoing. But slightly more concern for me is around the extra care housing. The note that's there is that it's no longer relevant. I'm just wondering where else strategically across the partnership it may better sit, given what my previous involvement in extra care in particular, what we know about the prevention agenda and specifics around placemaking and understanding the issues for commissioning of care, etc., that sit alongside that. So I'm not quite sure why we appear to be jettison is probably the too strong a word, but we're no longer, it's no longer relevant for us.
Yes, so I can partially answer that one, Councillor Jordan. So we are looking to introduce a new direction when the local housing strategy is agreed, and we have a contribution statement, which is part of the outlines the approach between the IJB and housing. So that will be picked up there. But in terms of extra care housing, I think I might need to hand that over to possibly Laura, might be able to pick that one up. And I think it's to do with different terminology and approach. I don't know if Laura's on the call actually. I can't see her, Laura Kerr. No, I think she's maybe.
I don't see her, Claire.
No.
She was and she dropped off. Can we pick it up and answer the question, Councillor Jordan?
That would be helpful.
Just because I don't know, and I suppose Claire and I don't want to give you the wrong information.
Yeah, no, that's fair enough.
Okay, we'll take that as an action point. Claire, it was around page 115 of the pack around the directions on community justice and equalities. So there is a direction where it's around no longer East Lothian Housing Health Social Care Partnership continue to work led by East Lothian County in relation to tackling poverty, to the poverty working group. So I can see that that's where that work will be picked up. So as IJB members, where would we then pick that up if that's going to be one of the directions that's going to be retired? Will that fit in somewhere else in the new set of directions that you'll be producing?
So I think that's probably somewhere we need to feed into the strategic planning group updates on our involvement in the tackling poverty plan. So colleagues are involved in that. I think public health colleagues are also, and we have an action plan. It's led by Paolo Verstri's team. So I think that needs to feed in the strategic planning group, but I don't think it needs a direction to instruct that activity to happen. So I suppose the message throughout the directions are about being proportionate, so issuing a direction where it's required, and that's not required for every single piece of activity. So I think that's a good example. So yeah.
Okay,
what was
so
the other one, Siobhan? Sorry.
Yeah, it was just that one, that one. So that will be picked up through the strategic planning group. So that's where those updates will be, just to make sure that we've got a line of sight of that that work around tackling poverty, because we know how intertwined that is in tackling poverty and health inequalities. Okay, thank you. Do we have any other questions or comments? No, just to say, Claire, thank you very much for this piece of work. It's been really valuable for us to go through this and just see where you feel that there should be the retirals and the areas to retain and to review, and having those core principles right at the very beginning and everything else following through. So this won't be the only time that we see the direction. It will be an ongoing piece of work where you'll come forward, as you've mentioned, as things change, as resources come to light, as different policies and priorities come forward that we've been asked to take forward, that we know that will improve outcomes. You'll come forward and make those changes to our directions. Okay, so for today, what we've been asked to do is to agree those directions. So this requires a roll call. So I'll pass on to Fiona Curry.
Thank you, Chair. The recommendations are set out in the report at 2.1 to 2.3, and I'll come to each member individually. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agreed.
Councillor Jordan.
I'm going to have to abstain at this point until I get clarification.
Councillor McFarlane.
Agreed.
And Peter Murray.
Agreed.
That's the recommendations agreed, Chair.
Thank you very much. Move on to agenda item number 7, and that's passing that on to Paul Curry, but also like to thank Morag Ferguson and Darren Thompson, who are both here. Morag Ferguson from East Lothian Council and Monitoring Officer, and Darren Thompson from NHS Lothian. He's the board of the secretary. So welcome to East Lothian IJB, and I'll pass over to Paul Curry.
Thanks very much, Chair. I'm going to present a short paper, and then Fiona Wilson and I will jointly present a presentation that just teases out some of the themes in the paper. The paper in front of you is for new and existing members, and it concerns the Standards Commission for Scotland Model Code of Conduct, the Associated Advice Note for IJB members, and the Ethical Standards Framework. And I'll come to the recommendations at the end. I just want to start by noting that IJBs, as devolved public bodies, have to adopt a code of conduct. The first IJB Code of Conduct for East Lothian was adopted in October 2015, and at least one person observing this presentation will be aware of that document coming in. It was updated in 2022, and the IJB subsequently adopted it, with all members at the time signing the code to indicate their acceptance. And that's been a requirement as people have joined the IJB. They are required to look at and agree the code of conduct and sign the same, and that record is kept by the clerk to the committee, Fiona Curry. The code of conduct reflects 9 key principles of public life in Scotland, which the paper sets out. It also says how its requirements should be applied in practice. It provides illustrative case studies and sets out how any breaches of the code will be dealt with, including sanctions available to members who breach the code. The Appendix 1 to the paper is an advice note for members of IJBs, specifically produced by the Standards Commission, and it sets out individual member responsibilities. It asks members to observe the rules in the conduct, helps members through these rules to interpret the provisions in the code, and directs that the code of conduct will apply in all situations at all times where members are acting as a member of the IJB, have referred to themselves as a member, or could objectively be considered to be acting as a member. The paper notes that in carrying out their duties as IJB members, councillors or non-executive members should adopt an independent position within the committee. It clearly delineates the strategic role of IJB members, their oversight and governance role, from any operational service management role carried out by the Chief Officer and or HSCP officers. It provides examples of where the code might be breached to help members in judging where the code is at risk of being breached. And it finally highlights the circumstances under which a member might be sanctioned and or disqualified. The code in the 2015 and 22 versions recognises the Chief Officer as the Standards Officer for the IJB, and the paper sets out the Standard Officer's duties, which are about advice, support and oversight of the code within the IJB. The Scottish Standards Commission has a very, very useful set of documentation that's available through the website, the address which is given at 310, and that helps members understand a range of different matters that might apply to their role as IJB members and how they can seek advice and further clarification regarding these aspects of the codes. So we're asking today for the recommendations at section 2 to be noted and to be acknowledged, but there's one request to the IJB to ensure that individual members of the IJB are asked to sign the code of conduct and, importantly, to update their register entries in the register of interests. Once the paper is approved, Fiona Wilson and I will then go quickly through a presentation regarding specific aspects of the code, if that's acceptable.
Okay, thank you. Can I ask if anybody has any questions or comments? Paul, what as you go through this, if anybody is in any doubt, because sometimes things can be crystal clear and sometimes it can be you're not sure, what advice would you give IJB members to speak to somebody and talk through?
In terms of our statutory role, I guess there's our input from Fiona Wilson as Standards Officer, but I'm more than happy to speak to any member of the IJB if there are any particular questions as well. But I would direct people to the website for the Standards Commission for Scotland. It's a really excellent resource, and it looks at a variety of scenarios and would help individual members to perhaps clarify things first through that route.
Okay, thank you. Fiona, did you want to come in?
Yeah, well, I guess a couple of things. So come to myself, and I use my colleagues, Darren and Morag, who are really helpful just to keep me right from a standards officer. But I wondered, Chair, is it helpful to do the presentation and then do the roll call? Because I wonder if that just might help illustrate what's in the paper and bring that. I suppose it might just add some questions, but back to you as Chair to make that decision.
Yeah, that'd be really helpful.
Okay, right, Paul, on you to get the screen, and Morag and Darren stand by. This
will take me a moment just to find the relevant presentation, so bear with me.
So just filling time while Paul does that. We're keen to do this annually. Just one, it demonstrates that we take it seriously and we have it docked. And just it gives a refresher to people, and there will be scenarios that come up that myself as standards officer and potentially colleagues haven't come across before, and we just work through. But this is just really to give a flavour. It's got some examples at the end. We're not going to go through every slide, and we're trying to keep it light. But the importance of your role as IJB members, and that kind of impartiality. So Paul will start, and we'll wing it together, and just please people ask questions, because we would rather have the questions than uncertainty, and then hand back to the chair. So Paul,
can I just confirm members can see that?
Yeah, I can see it.
First slide is an uplifting slide of Tantallon Castle in East Lothian, luckily.
You've gone on mute, Paul.
Some of this background is in the paper, so I won't go into it in detail, but just a reminder that the first code of conduct operated from October 2015 with the new code accepted and signed by members in 2022. The Chief Officer, Fiona, is recognised through the documents as the Standards Officer of the IJB, and she's summarised some of the role that she has in relation.
You're back on mute.
My slides, so hang on. Can you hear me again?
Yep. Okay. Oh, you've gone off now, Paul. This was supposed to be seamless, and I think he's just cut himself out.
Yeah, it's completely left.
And he's the one with the presentation, so that doesn't make us seem seamless at all. So the standards officer is not looking very good in this at all, as per her standards. So hopefully he'll pop back on.
Yeah, we'll give it a couple of minutes just to get back in. I see him up on the screen now.
I'm back. I'm sorry, I don't know why that didn't work, so I'm going to try again. There may be some technical point at my end, so I'll try a different approach. Again, can everyone see that?
Yes, it's up.
Okay. Tantallon Castle. We move on to just a reminder that first code of conduct ran for 7 years, from 2015 to 2022. The new code of conduct was adopted in 2022, and individual IJB members at that time and new members have signed that code of conduct. The standards officer role, I'm going to pass on to you if you want to just to reflect on that.
Yeah, so some of this I just picked up in the introduction. So one, it's about you yourself as individual members receiving appropriate training on induction and thereafter. And I know many of you had that before I joined. I suppose it's also, I want you to go away from here and reflect, is there anything we're missing that we can support with, and happy to do that. It is about maintaining these high standards of conduct, so that is about me promoting that. I suppose I'm keen that if members have concerns, they approach me, and I have had that in my short time here, and also just how I use Darren and Morag for support around doing that. So that has happened, but I want that to be an approachable open door there. And then also just that advice role, and that's often what it's come down to, just that seeking advice, and just making sure it meets the code of conduct, and that kind of, I guess, how you're seen as IJB members. And then there's the register of interest that is maintained, and Fiona Curry coordinates that, and we do that annually or as new members join, and then just I guess for me as a standards officer, the role of investigation in some cases, and then report on any matters relating to ethical standards, having that framework and compliance. So it's straightforward as what you would expect, but it's just making sure you're all aware of the process. Next slide, Paul. And then I guess just drawing you around that kind of that public bodies, we've got to adopt a code of conduct to comply with that ethical standards in public life. So that's the Act. And then just drawing your attention, there's really good examples on the Standards Commission website, where it gives some scenarios, just takes you through the process. So I would recommend, if you wanted more information or just assurance, please look it up. It's really helpful and user friendly as well. Yeah, I suppose I'm just really reflective as IJB members. You will come with different interests and backgrounds, but as an IJB member, you are seen to be independent on this board, and sometimes that encourages you to be, even though you yourself think you're independent, just really demonstrating that to the wider audience. Okay, and then the 9 principles of public life you will know through your other roles, but duty, selflessness, integrity, objectivity, and accountability and stewardship, openness, honesty, leadership and respect. And that's the culture we want to develop here within the IJB. I think it's back to you, Paul.
It is, and I just wanted to take a moment to look at the difference between the strategic role, the governance oversight, directive role of the IJB, and the operational work that's carried out by Chief Officer and other officers of the Health and Social Care Partnership. So it says that public body members, and these are global public body members, not just for IJBs, but other public bodies. So they are to provide strategic leadership, ensure the body meets its aims and statutory obligations, ensure it puts the needs of its service users at the front of any decision making, holds the chief executive and senior management team, in this case the chief officer, senior management team, to account by scrutinising the way in which services are delivered and how policies and procedures are implemented, making or approving decisions, and ensuring financial stewardship is achieved through efficient use of resources. It goes further by directing the IJB members' role in scrutiny, how some operational managers have strategic implications, and how some decisions may have operational and strategic elements. For example, the expenditure does not fall within existing budgets. It further goes to clarify that members may be required to become involved in operational management and decision making because of their particular contracts for employment, a statutory provision, or on invitation from the chair of the public body. A few examples are given regarding that. But it does say the members who take on any operational decision-making role must be clear on what that role involves. And it's acknowledged that there may be occasions where it's difficult to distinguish between operational and strategic matters, and that's where Fiona, as Chief Officer, should be asked for guidance. And then Fiona, it's back to you.
Yeah, so the Standards Commission for Scotland provides member advice notes on, you know, the following, and I suppose it does change all the time, just as we move in the world, but there's notes there just on what it provides. So I'd ask you just to note that, and then the advice of integration joint boards. Like we've touched on a little bit, review of the responsibilities under ethical standards frameworks, emphasises the kind of personal responsibility to observe the rules in the IJB's code of conduct, directs the IJB's the code of conduct that applies in all situations and all times when members are acting as the IJB. And I know that can be challenging at times given some of the representation you have, but it's important that people are independent. And then the advice note is just around potential breaches of the code to assist members in judging where the code is at and highlight circumstances where the IJB member might be sanctioned or disqualified. Okay. Again, it's back to the point I raised earlier, just around your responsibility to make sure your register of interest is up to date and kept current. And then declare, as Shameen did at the start of today's meeting, just a declaration of interest if there's a subject area in an IJB meeting that is impacted. I've touched on the next point several times. And then again, the third point, just around the majority of IJB decisions are reached by consensus, occasions where a vote is required. And we've seen that over the last year. So it's just really for you to familiarise yourself with the revised joint integration scheme for East Lothian, which took place 15th of May and followed approval by the Scottish ministers. And I think, Paul, it's back to you.
Yes, now I just want to close by, you all have a copy of this presentation. It sets out some case studies which are from the Commission, and these are very helpful in trying to put yourself into a position where there might be some issues that the code helps individuals to handle. So there are 3 of these case studies within the presentation. We're not looking to go through them. If anybody has any questions to ask about the presentation or the case studies, then Fiona can answer from a standards officer position. I'm happy to answer any questions from my involvement in this. Thank you all.
And I guess just before it goes back to the chair, Morag, Darren, I don't know if there's anything you want to add as, I guess, partner advisors to me as a standards officer. Are you happy? I'll take your silence that you might not want to say anything until questions come up.
Are you happy for me to come in now?
Yeah,
Yes,
Morag,
come in, Morag.
sorry.
Yeah, I mean, I think that presentation has covered it really well, and I'm hoping that nothing in that will come as a surprise, certainly to the councillor members to whom I have given similar presentations over many years. I think, though, there is that just additional complexity when you are in a dual role, when you represent your home authority, if you like, most of the time, and then you have to put on your IJB hat and represent the IJB. And although the guidance is really good and really clear, it is also easier to write than to do. You know, it's simple to say, you just, you know, be independent. Don't think about the council, think about the IJB. So I do appreciate that it's a complex sort of governance scenario you find yourselves in as members of the IJB. So I would just really reiterate both Fiona and Paul's advice that if you are in any way concerned about your position, about whether you have a conflict, by all means, feel free to, if you're a councillor member, feel free to approach me directly. I'm more than happy to give advice. And I guess my only ask would be to try and think about these things in advance when the papers come out, or you know what's what's appearing on the agenda. It's always better if we can have a bit of time, because sometimes they're not just black and white. There needs to be a wee bit of reflection and consideration. And the worst case scenario is when you get the call 2 minutes before the meeting starts to say, I've just looked at this paper and I think I'm going to be in a conflict. So a wee bit of advance warning always helps. But otherwise, no, I think Fiona and Paul, you've said everything that I would have said in your situation. So thank you.
Thank you very much. Can I ask if there's any other comments or questions for Fiona, Morag or Darren? No, I think that was a very comprehensive presentation, hence no questions from anybody. So thank you very much for that. And while the recommendations don't explicitly require agreement given the subject matter, I think a formal roll call would be something helpful for us to do. Are we happy to do that? Yep, okay, thank you. I'll pass it on to you, Fiona Curry.
Thank you, Chair. Before I do the recommendations, just to advise members that the annual request for the update of registers of interest will be going out shortly, and I'll also, as part of that, sweep up with new members signing of the code and making sure everything's in place. The recommendations are set out in section 2, 2.1 to 2.4. I'll come to each member individually. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agreed.
Councillor Jardine.
Agreed.
Councillor McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you. That's the recommendations approved unanimously, Chair.
Thank you. And we move on to agenda item number 8, which is the provision of adaptations funded by private sector housing grants with Leslie Berry and Morven McClelland. I'll come out of the chair and let you chair this section because I declared an interest, even though there isn't any direct influence or funding for care and repair East Lothian. I thought it was appropriate to come off it. So I'll let you chair, Peter.
Yeah, thanks, Shameen. Obviously, you've all had a chance to read the paper. It's by the Chief Officer. So, Fiona, are you presenting this in any more detail, or who is presenting on your behalf?
Leslie and Morven.
So I apologise to everybody this afternoon. Every time
You're on mute, Leslie.
I think that might be the problem.
the problem is my problem. I'm going to put my camera off if you don't mind, because my signal is quite poor. So I'm just to thank you very much for this afternoon. I will just start the ball rolling, and then I'll ask my colleagues Kirsty White and Morven McClelland to talk to the paper. So the purpose of this paper is to update the IJB on actions underway to respond to a committed overspend in the East Lothian private sector housing grant budget. This is used to provide equipment adaptations for people who live in privately owned or rented properties in order to improve and maintain independent living and to avoid unnecessary hospital admissions or care packages. And I'll ask Morven or Kirsty to talk about the recommendations.
Thank you, Leslie. For those who don't know me, my name is Morven McClelland. I'm one of the Community Occupational Therapy Team Managers, and thanks for having us to share this paper with you today. So initially, the Executive Management Team requested that we prepare a paper for the IJB in conjunction with the members' library report to be submitted by Housing. In response to this paper, it therefore presents the following recommendations, and we're asking that the IJB notes our statutory functions, applying to provision of property adaptations for people with physical impairments with the intention of enabling independent living, and then agree the mitigating actions by the Community Occupational Therapy Team and Housing Services regarding these adaptations in owner-occupied and privately rented properties. I'm not sure if you've had a chance to go through the report in detail. So would you like me to go through the background, or shall I just make reference to the first couple of points, which are probably most important?
Yeah, can you assume more that we've all read it? Just a couple
Okay,
of salient points for the
perfect. Great, thank you. So to that point, ELC Housing Service manages an annual private sector housing grant budget of 363,000, just over, and that's on behalf of the IJB. An additional budget of 329 for the care and repair service supports homeowners in the adaptation process. In June this year, East Lothian Rehab Service received notification from our housing colleagues of an anticipated overspend in the adaptations budget, and then we were asked to review the criteria to use to determine eligibility for adaptations and grant funding. So this, in order to mitigate risk, because obviously there's risk associated with that, we looked at this in great detail and we decided not to revise the criteria as requested, but we have recommended that we continue to use the criteria that's set out by the Social Work Scotland Act of 1968. This was further revised by COSLA in 2009, and that refers to thresholds of criteria, for example, your urgent, substantial, moderates and low. And we routinely kind of work with urgent, substantial and moderate, being from an occupational therapy background. We're guided and governed by the Health and Care Profession Council, which is HCPC, along with the Royal College of Occupational Therapists, and we've got a very strict code of conduct, ethics and standards of practice, and therefore have to all times provide the best possible care to all of the clients that we see. So what we have done instead of revising the criteria was look at fine-tuning the eligibility criteria to help make it more focused on occupational therapy tasks. It still sits within the original framework that the Social Work Scotland Act sets out, but the paper that's attached to that you could look at in more detail is the Community Occupational Therapy Eligibility Criteria, which is dated September 2023. We've also updated our occupational therapy practice guidance to support clinical decision making and also ensure all options are explored before we authorise quite expensive adaptations. And we are talking £6,000 through to £20,000 sometimes. And off that budget, it doesn't leave an awful lot to play with. We're reviewing all our cases who remain on the waiting list for those outstanding adaptations, and we're using a highly experienced occupational therapist. We hold monthly adaptation panel meetings at the very highest level to ensure governance on decision making, and that's at a sort of multi-professional level as well. And it's also important to note that decision making is for the cases that are presented as critical only, although we still work towards moderate, substantial and critical. For interest, we have 256 people waiting for assessment, of which approximately 163 live in owner occupied or privately rented properties. We won't be asking for adaptations for all those people, but it's just to give you some sort of idea of how many that might pertain to. There are currently about 30 people remaining on our open list for funding approval, which will likely roll on to 2024, so April 24. There is only about 15,000 left remaining in the housing grants budget. So we have spent all of the remainder of that. And we can spend that obviously quite easily because we've still got 30 people waiting for adaptations. But this, I'm hoping this sets out some sort of context for you in terms of what we're looking at in terms of going forward next year. That's really the paper in summary. And I guess Kirsty and I would be very happy to take any questions on that now.
Thank you, Robin. That's actually really helpful to hear you explain it the way you did, and obviously supplemented by the good paper that you've presented to the meeting today. Just before we go to questions, I know Phil wants to come in, but we are being asked specifically to agree the mitigating actions. And I would ask you to focus your questions around that particular point if you can. So, Phil, you want to come in with a comment, or is that a question?
No, it wasn't a question, just more a comment, and we had hoped that Wendy Maguire would join us today and present a paper on the spend. So we commit, this is like a commission service that Wendy manages through Care and Repair, and obviously Morven and Kirsty and Leslie are here around that kind of guidance around how do we prioritise when we have a limited budget. We have this within our scheme of delegation until next year, so it will go out with the budget, this grant. So, but I am keen that, and I've asked Wendy to come and present it next year in December at the next meeting, just because I think we need to dock the spend from that purpose. So I just wanted to put that in the context of it as well.
Thanks.
Yeah, thanks, Fiona. Do you want to comment on that, Marvin, or shall I go to further questions?
No, go to further questions. That's fine. Thank you.
Okay, we've got Marlon and then Lynn. So Marlon, please.
The criteria don't seem to indicate that an integrated quality assessment is required, and just wondering if that's something that's going to be done. Obviously, it affects people in the rental sector, that women in particular would be could be disadvantaged.
I think we are very happy to explore lots of options going forwards. This is a fairly new task, so we're really reacting on a kind of crisis level at this stage, but I take on your points absolutely, and that's something Kirsty and I can address outside of this meeting.
Thanks.
Thank you, Marlon. Lynn, please.
I'm just looking for a wee bit of clarity in terms of the linkage between the waiting list and the spend on adaptations. I think I probably understand better the spend on adaptations and how that's possibly significantly impacted by the cost of living issues and access to relevant materials and stuff. I'm just trying to understand how those two actually sit together if one's done predominantly by allied health professionals, OTs, etc., and the others delivered by more of the housing function.
That's a very good question. Kirsty, can you clarify that a little bit more? I guess part of that is historical. Sorry, I'm getting an echo. I'll pass on to Kirsty, sorry.
Yeah, in terms of obviously from an occupational therapy perspective, the report refers to the waiting list for occupational therapy assessment, but obviously from then we will refer into the Care and Repair service to progress adaptations to private, to owner-occupied properties or privately rented properties. And what we have at the moment is people that, because there isn't inadequate funding available to progress, then there are a list or cohort of people that are waiting to have their adaptations progressed. So they have been seen by an occupational therapist, but we're just waiting for the adaptation to be progressed. Does that answer your question?
Can I just come in just now? I'm so sorry. What we're looking at is what there is to assess
you're breaking up.
Leslie, Leslie, I wonder if, so part of it is Lynn, I'm picking up, sorry to interrupt, you're picking up, if you've got the AHPs making the assessment and making the recommendation for a budget that they are not managing. So then it's that kind of demand is what I'm picking up. And Kirsty and Morven, you maybe just want to talk about the process you've got to around with housing, around that the panel that you've got set up, which I think joins up what would give Councillor Jardine the assurance.
Sorry, yeah, absolutely. So thanks, Fiona. We, in response to some of this work going forward, we have set up a multidisciplinary panel. So you've got physiotherapists, occupational therapists, general manager, chief HP, you've got head of housing, you've got a team manager in housing strategy, and professional leadership for both occupational therapy and physiotherapy in there as well. So initially what happens is that the occupational therapist will get the referral, carry out the assessment, will be scrutinised quite heavily in terms of their recommendations. We will explore all the options available to the person living at home to look at the most efficient, and I mean most efficient, because we have to be cost efficient too. So if we can provide basic equipment, then we'll do that. If those don't meet their needs, then it obviously goes up a level and would require an adaptation. For example, a wet floor shower, just to make things really easy for people to visualize. If that's then approved by one of the seniors or team managers, it then goes to the next level, which is this kind of scrutiny panel. For better words, it is a scrutiny panel. And then it will be discussed there to determine what kind of level of excuse me, priority, but urgency, more importantly, whether it's a critical case that needs to then be progressed further. Because we've almost run out of money, it's really important that we make sure that we prioritise those people really carefully. We don't want to miss anybody. We're reviewing people frequently. It's a tricky one because we know how many people are coming through the door and how many are going to need the adaptations, but not holding that budget sometimes also makes it also tricky because we're not managing that budget. So as in, it's not our budget to manage, so we can't see what's going on routinely. We've most recently become obviously acutely aware of the risk of it running out, and we're heavily involved in this process now. But historically we haven't been. So this is very new. We've only really been aware since sort of May, June time. We've been working hard in the background to look at all the mitigating ways that we can reduce the risk to people living in the community. We haven't got a perfect plan, but the plan that I've roughly presented to you today is one that I think, or that we certainly believe, that we can manage in the best possible way to keep people as safe as possible. And with the regular reviews, we're keeping on top of where people are beginning to shift in their functional ability to manage safely at home. Does that make sense?
Yeah, I suppose I'm aware that there are a cohort of people out there who possibly need the assistance for the assessment, but could self-fund for the works.
Correct.
Yeah. How are we managing that?
Yeah, so we've got the support of care and repair. So anybody who is capable or willing to self-fund will signpost them to care and repair, and care and repair will support them through that process. And they've got access to lots of different contractors that are very well versed in providing adaptations. So they can do it in a supported manner.
Yeah. Sorry to those that are waiting, but Fiona, did you want to come to that point?
Yeah, so I think that's why it's helpful, Councillor Jordan, on having that other paper, because there's an element of operationally how this work and the spend that I guess complements what Morven is saying, because I think some of the challenge is around the opportunities that are available for care and repair. Have we maximised that as much as possible? So that it answers the question you're asking. Actually, we've got a cohort of people that might just take the decision that we will go and fund this ourselves. So that's why and I'm sorry, but that's why I think that was useful to have them together. But I suppose it's a bit like we see with other services around, say, care at home as an example. We've got this demand. How do we manage the demand, recognizing that people meet the criteria? How do we prioritize it? So we do it just now with care home placements, care at home, and we're just trying to do a similar model around the criteria that gives that professional assurance while managing the budget. And we're clear we're not going to overspend on the budget, because it will go back to the council as a next April, David King, I'm hoping. I think that's right. So I hope that helps, Councillor Jordan.
Yeah, definitely does.
And we'll
Thanks
get the other paper.
Yeah.
Yeah, thanks for the question, Lynn. It was helpful to tease all that out. Maureen, please.
Thanks, Peter. Morven, I'm just wondering, do we need to look at other funding pots, basically, through the third sector, community sector, because I'm sure there's a couple of funds that will support some of the work that you're doing, but I think, maybe not the redecoration cost, but actually to get what they need.
Yeah. Maureen, that would be helpful to touch base with you. I think probably what we should do is put you in touch with our colleagues at Care and Repair. They have access to quite a significant pot or option of charities for additional funding towards adaptations or a contribution towards, but they may not have been able to explore all the ones that you may also have access to. So I think that would be a really good idea.
There's something also, Morven, about the income maximisation, because of, you know, the benefits, if people are claiming the correct benefits, that also
yes,
opens up avenues to them. So again, yeah, happy to have this, take this conversation a wee bit further.
So I will put you in touch with our colleagues outside of this. I'll put you in touch via email, but that would be really helpful. Thank you so much.
Thanks, Morven.
It's very, very helpful to suggest that, Molly. Thank you for bringing that in. Siobhan.
Yeah, it was just around just to thank Morven and Kirsty, because this is a really difficult, challenging area, and all the work that you're doing behind the scenes, and the other partners and other staff that are supporting you. It was just to ask, because what you've said is that you'll be focusing on critical, and as you do that, the substantial will slowly be moving up to critical. And I just wondered how you get that. It's a really difficult balance, how you balance that you, by leaving substantial too long, that it doesn't become critical. And the other one was that a lot of this work is preventative, is early intervention and prevention. And I wonder, I know Kieran appeared to you a huge amount of data analysis of how we can pull together that this is quite significant preventative work. And I know that Kieran Repair indicated that in December they do get the opportunity to request funds, and I just wondered how, as an IJB, we might be able to support that call and be able to demonstrate the significant impact that it has on families, and enabling them to get home a lot quicker, because they might be stuck in hospital, or be able to stay at home where we want them to stay at home and not be in hospital. So it was around the substantial and critical, and how we support, possibly as a recommendation, how could we work in partnership with Care and Repair and support their call to resource this area of work, if they're going to do that in December anyway.
Do you want me to answer the element about the substantial part, Chair?
Yeah. If you can.
Yeah, of course. So we have it currently in place. Obviously, we've got all our other work that's going on in the background, and it's important not to forget about that, because we don't want to do anybody a disservice that are living out there in the community waiting for just our normal day-to-day assessments. However, what we have put in place is we've got a very experienced occupational therapist who works directly with Care and Repair. She is regularly reviewing the substantials. So she'll call them by phone, she'll go out and visit them and just make sure that things are either in status quo, and if they're not, then we have a conversation about the risks that may be going to tip them over into the critical level. So we're keeping a regular review on them. It's additional work for us, and that I guess is also important to note. We are in a very, very challenging situation, and I don't think, I've been in East Lothian since 2007, and I don't recall us ever having this situation. So it's new, it's an emerging time for us. We're kind of working on our toes all the time, but that's what we have in place. And if things don't work, then we'll just change the way that we do work. So we're very much open to comments and suggestions. We think we've got that covered at the moment. But yeah, there is a risk, Chair, that we miss something. There is a risk, because these aren't people that are on our open books. So they're sitting with Care and Repair waiting for the progression of the works. So there is a risk, but we're trying to mitigate that risk by getting one of our occupational therapists in to review them almost every fortnight, if that's feasible for this OT to do that piece of work for us.
I add a little bit in there. It's just to say that obviously you had asked about the substantial level of criteria, that we are actually also reviewing the people that are on the other lists, the moderate lists as well, because you're absolutely right that it's very easy to go from one to another. It takes a fall, or it takes something relatively minor, or an illness, or whatever. It could be any number of things that could tip somebody from either a moderate situation into a critical situation. So we're very mindful of that, and are reviewing that on a regular basis, as Morven's described.
Yeah, thank you.
That helps, Siobhan.
Thank you.
Yeah. Okay, I think we've given that a pretty good hearing, and Marvin and Kirsty, it's clear from your way you've described it that you feel very much responsible for this. I can sense it in the way you've described it. So, you know, I think we could take nothing more than the passion that you've really got for trying to make this as good as it can be. And it's out with your control for it to be absolutely perfect. But it sounds like we've got good people in there that are trying their best for those that need the help that you're clearly overseeing. So thank you both for that. And hopefully we can see a situation in the future where we're not just responding to those that are critical, and perhaps do some more analysis on the impact of those that sit waiting. However risk assessed that is, because that's going to take huge capacity, as you've rightly described, Marvin, to undertake that work. It'd be interesting to see what impact from a whole system perspective, those that are waiting that potentially do fall or have some other adverse event, what that effect has on the broader system costs. But that's for another day. Anyway, Fiona, I think we're having to do a roll call for the second recommendation.
Yes, I'll just cover the recommendations together. The recommendations are set out at 2.1 and 2.2 in the report, and I'll come to members individually. Councillor Akhtar.
Agreed.
Andrew Cogan. Andrew.
Apologies, I was on mute. Agreed.
Thank you. Councillor Finlay.
Agreed.
Councillor Jardine.
Agreed.
Councillor McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Siobhan, I'll hand back to you.
Thank you very much. Thank you, Peter. And that's the end of our October Integration Joint Board meeting. So thank you very much for everybody that's presented papers and all the work that's gone into the papers. You can see there's a lot of work going on and a lot of challenges that staff are facing and managing on a day-to-day basis. So I think just on behalf of the IJB, while some of the staff are still here, like Kirsty and Marvin, and David, just to say thank you for everything that you're doing to support people in the Health and Social Care Partnership. And we recognise a lot of the challenges that you're facing, and we'll be looking at every way that we support you. So thank you very much, and thanks for everybody for their participation, and see you at the next meeting. Thank you. Bye.
Thanks. Paul, can you switch off the recording?